Hello, this is Joe Uhan, and I'm on the floor for this next one because we're talking about lower extremity nerve mobility. So in the first video, we talked about just the general kind of background with what nerve mobility is, why it's important, and all of the associated kind of structures and elements. So I'm going to review that a little bit in terms of how we treat nerve tension in the leg. So again, nerve tension is the idea that I should have enough nerve that flows down, if we're talking about the femoral nerve, and flows into the thigh here, or the sciatic nerve is flowing down here, becomes a sciatic nerve, and then flows into our leg. There's a couple really interesting nerve tension tests for each of these. So if we want to assess femoral nerve, this is an interesting one. One of the hallmarks of nerve tension testing is looking at the impact of what the rest of the spine does on that thing. So it's one thing, for example, if I do a quad stretch, obviously it's normal to feel a stretch in the front of my thigh. However, if I do something like this, and that increases the stretch sensation significantly or replicates my symptom in my thigh, that's a nerve issue. Why? Because there's no muscle that goes from my neck all the way down to my knee. Only the nerves do that. The quads go from maybe the low back, pelvis into the knee or the shin, but the nerve goes all the way here. So if I tense this, and I feel significantly more stretch or pain replication in my thigh, again, that is a positive finding for femoral nerve tension. Same thing with sciatic nerve. So I'm going to sneak over here. So if I'm sitting here and I do this, and I feel like a moderate amount of stretch, that may be my hamstring. But if I do this and then I add a slump, again, my hamstring doesn't start here. If I feel extra stretch or replication of my symptoms in my leg, doing a slump or any sort of movement in my spine, that's nerve tension. So for those of you having some sort of lower extremity pain, especially if it's hamstring, calf, medial shin, ankle, even foot pain, and you can replicate it doing something like this, or it just feels significantly tighter, or let's say a significant range of motion loss from this side versus this side, then again that's suggestive that you may have a nerve tension problem. So those are our tests, and like we talked about with the upper extremity video, they're also one of our ways that we can treat this. So again, one of the things that we talked about was if we're going to treat nerve tension, we have to first treat and normalize the mobility of where that cable goes to begin with. So we talked in the article about, one of the biggest factors in the accumulation of nerve tension is either stiffness or injury to the spine. Because these nerves go through here and then flow into the leg, I can have stiffness up here that plays a role down here. One of the things that I haven't mentioned yet is that it's really important to do this work first, the mobility of the spine first. Because if we're stiff here, again, it's like we go back to that analogy of the hose is supposed to go around the house and it's getting stuck halfway. If we just yank on that, chances are it usually doesn't work out well. Something around the house is going to get broken or flipped over or disturbed. We have to kind of go clean up wherever that hose came from. So that means for in the neck, if we have an arm issue, we have to do spinal vertebral stretching first. And for the low back, we need to do lumbar or even thoracic or even cervical mobility first. We want to move the bones around which these nerves flow, make sure they're moving normally before we do our actual nerve mobility. So there's a variety of things you can do for lower extremity, I really love the foam roller. We talked about this before, to do rolling on the roll, to be arching over the roll. And this is a great tool to just make sure that this spinal system is moving. One of the other things you can do is just general kind of yoga-like stretches. Upward dog, downward dog, or one of my favorites, which is trunk rotation. So rotation's an interesting one because with running, there is a little bit of rotation, but it's also a way that we can kind of tease out stiffness in the nervous system. So I'm going to show you that in a second, but I first want to show you the two other ones that we've talked about. So if you think you have nerve tension in the front of the leg, what you're going to want to do is to go into that tensioning position, just a normal quad stretch. And you can do this in a variety of different positions. I'm going to show you this one first. And then what you're just going to do very simply is add this kind of head and trunk motion. Some people, it's interesting, most people will tension in flexion. Some people will actually feel more tension in extension. It doesn't really matter. You're going to keep this tissue, this local tissue, under a little bit of a stretch, then you're going to add a spinal movement. Just like before, we want like a modest amount of tension, be gentle, go on and off for maybe 10 repetitions and then let it be. So that's the strategy for femoral nerve. If we want sciatic nerve, which really does the bulk of the back of the leg and all of the lower leg, here's one thing we can do. We go back to what's called the Slump Test. We use this to assess. We can also use it to treat. So this is a tensioning maneuver, just doing this at the knee. Or you can then add movement at the foot. And what you're looking for is any position, any movement that might really tease out the most tension or replicate your symptoms. This is a tensioner. A floss that we talked about in the upper extremity video involves I tension here, I give it away there, I tension down there, I give slack here. So this would be a floss. It's slightly more gentle, but both of them really have to do with how does this nerve kind of slide and glide in the leg. So the last one that we're going to do, and one of my favorites, is going to be a trunk rotation with those similar movements. So what we do in this position is come down. You're going to go into a trunk rotation position. So this is your spinal stretch, right? So we're stretching here, stretching open the back, and going into this spinal twist. Here's your nerve mobility. The first one is straightening the knee as we've done before. So we can do this gently on and off 10 times. Then, once we're done with that, we can add an ankle pump or even an ankle swirl. Again, trying to tease out wherever it's stiffest or wherever our symptom is. Lastly, if we wanted to be really cute, and you can't quite see me very well, but I can add head motions to this too. So doing a sort of a rotation, you can see in this case I'm going the same side. That's sort of a floss versus going opposite side. That's a little bit more tension. But again, the theme here is we're doing some leg motion in the position or direction of tension, and then we add spinal mobility. There's a couple other ones that we can do, but that's a really nice starting point. So again, check out if you have a symptom that isn't going away, try these tests. If they seem to replicate your pain or are really stiff, try some of these nerve mobility things and see if that can help get you over the hump.